let's see an NCLEX RN video based on acid-base balance. When you talk about acid-base balance, it refers to the homeostasis of the hydrogen ion concentration in the body fluids. The hydrogen ion concentration in the body fluids is expressed in terms of pH. So you might have heard about acidic pH and basic pH or alkaline pH. So that is what is dealt in this video. Let's see the first question. How does a nurse interpret an arterial pH of 7.47? The options are acidosis, alkalosis, compensation, homeostasis. The answer is alkalosis because if you see this, the normal pH of our body is 7.35 to 7.45. The patient's body becomes acidotic or acidosis happens when pH is less than 7.35. The pH is less means there is increased hydrogen ion concentration. And the pH which is more than 7.45 is termed as alkalosis. At that time, the hydrogen ion concentration decreases. So you need to check with the hydrogen ion concentration and you will be seeing the values whether it is below normal or above the normal value. And based on that, we will be considering it as acidosis or alkalosis. Fatal blood pH levels are less than 6.8 and greater than 7.8. So if it is less than 6.8 also patient will die, and if it is more than 7.8 also the patient will die. So you need to have a good check on the pH values when we are seeing the ABG. Which parameters of the ABG result correlate to the assessment of the base component? pH, partial pressure of oxygen, partial pressure of carbon dioxide and bicarbonate. HCO3 bicarbonate is the base component and PaCO2 is the acid component. So answer is HCO3 or bicarbonate. You need to know about the normal ABG, what all things you need to see. You need to check for the pH, whether it is in 7.35 to 7.45 range. Partial pressure of carbon dioxide 35 to 45 mm of Hg. Bicarbonate 22 to 26 milliequivalent per liter. Then something known as the base excess, that is in the range -2 to +2. Base excess, it reflects the level of bicarbonate and other bases such as proteins and hemoglobin in our blood. So the base excess which is less than -2, that means less base is there. That means it is more acidic in nature. And if more base is there, base excess is more than +2, that is related to the alkaline nature. That means the acid is deficit there. Partial pressure of oxygen 80 to 90 mm of Hg and saturation is more than 95%. These things, if all the values are in this range, it is considered normal. Hope you understood this. The third question, which acid-base imbalance should be suspected with the ABG result? You need to check pH. pH is 7.47. That means the pH is more it is alkaline. Then PaCO2 31 mm of Hg. PaCO2, if it should be in the range of 35 to 45 mm of Hg. Here it is less. PaCO2, it is less than 35 mm Hg, that means it is alkalosis. Then bicarbonate level is normal. So here, since the problem is with the carbon dioxide part, it is related to the respiratory system. And if the problem was related to the bicarbonate, we can tell it is related to the metabolic. Here, the metabolic part is normal, but the respiratory part, partial pressure of carbon dioxide is disturbed and it is alkalosis. So the answer is respiratory alkalosis. So here you need to understand two things, normal PaCO2 and normal bicarbonate. Normal PaCO2 is 35 to 45 mm of Hg. If it is greater than 45 mm Hg, carbon dioxide is more. That time acidosis. Carbon dioxide more is related to acidosis because carbon dioxide will become carbonic acid. More carbon dioxide, more carbonic acid, acidosis. Less than 35 mm of Hg, that result in alkalosis. If you see the bicarbonate value, the normal is 22 to 26 milliequivalent per liter. If it is less than 22 milliequivalent per liter, that is acidosis. And if it is more, the bicarbonate part is more than 26 milliliter, that is base is more, that is alkalosis. So you have to understand this basic concept, then this acid-base imbalance unit is very easy for you. Which acid-base imbalance does the nurse suspect on the basis of the following result? pH is 7.31, partial pressure of carbon dioxide is 52 mm of Hg, bicarbonate 28 milliequivalents per liter. Here some terms like uncompensated and partially compensated has come. So you need to have an understanding what is compensated, fully compensated, uncompensated and partially compensated. In the next slide we will be dealing it in detail. But here let's check. The pH is 7.31. pH is less. That means acidosis. Then PaCO2 also, here it is more related to acidosis. More than 45 means acidosis. Bicarbonate also is disturbed. Here this is more related to alkalosis. Bicarbonate is greater than 26 milliequivalent per liter. Here alkalosis. That means both bicarbonate and carbon dioxide part, both are disturbed. So that means there's some compensation they are trying, but the pH is not normal. The compensation they are trying, but pH is not normal. That means some partial compensation is happening. Again, if you are looking at the question, this shows the pH shows acidosis, PaCO2 also shows acidosis. So, and this is showing alkalosis. That means two are showing acidosis. That means the thing is related to PaCO2. That is respiratory. Partially compensated respiratory acidosis. If you don't understand, no problem. Next slide will explain little more in detail. How to determine the acid-base compensation? There are certain steps. First, you have to check. When a question comes, you have to check, or when you are seeing the ABG value, you need to check. Does the pH indicate acidosis or alkalosis? Previously, the pH indicated acidosis. Second, if pH is normal, in which direction it is trending? Which point it is nearing? Is it near to 7.35 or is it near to 7.45? There you need to see. Check the pH whether it is normal or not. Third step, has partial pressure of carbon dioxide and bicarbonate changed for acidosis or alkalosis? In the previous thing you understood the partial pressure of carbon dioxide and HCO3 both has changed, but earlier question pH showed acidosis and the value which showed acidosis was PaCO2. That indicate it is related to respiratory thing. And the fourth point you need to consider is, has the opposite system, that is the bicarbonate system is the opposite at that time, whether it has worked to correct and shift back to the normal pH. Of course, its value become alkalosis. That means the opposite system has worked so that everything could be maintained to normal, or pH was trying to be getting normal. So this is how you need to determine how acid-base compensation is happening or not. Let's see the different types of compensation. This also will help you understand the previous question. Uncompensated means pH is abnormal. Either one, PaCO2 or bicarbonate. Any one is abnormal in that case, not both. Then there is no indication that the opposite system tried to correct imbalance. Only one thing changed and pH is abnormal means uncompensated. Partially compensated means pH is abnormal. This is what happened in our question. pH is abnormal. Both bicarbonate and PaCO2 both were abnormal. The opposite system has attempted to correct for either but has not been completely successful. It becomes completely successful when pH becomes normal. Then when you see for fully compensated, the pH is normal, but both PaCO2 and bicarbonate, they both are abnormal because they are trying to compensate. That is why the pH became normal. The normal pH indicates one system has been able to compensate for the other. So these are the different types of compensation. Hope you understood. When the body is in a state of alkalosis, which is the role of renal buffers? So here you need to understand certain things. The partial pressure of carbon dioxide is used to evaluate the respiratory component of the acid-base balance. That means the lungs will be regulating the acid-base balance by the ventilatory function. If carbon dioxide amount is more, that means at that time the partial pressure of carbon dioxide also will be more. Hyperventilation should happen. At that time, more oxygen will be taken up by our body and the carbon dioxide will be moving out. That is how the lungs will be compensating. In if you are seeing the bicarbonate system, it is regulated by the kidneys. When the bicarbonate concentration, if we evaluate and see that it is more than 26 milliequivalents per liter, that time alkalosis happens and kidneys try to remove it. So let's see the options. The options are increased excretion of water, decreased excretion of water, increased excretion of bicarbonate, decreased excretion of bicarbonate. Here you need to understand alkalosis. Alkalosis means bicarbonate is more. So bicarbonate needs to be excreted by the renal system. So the answer is increased excretion of bicarbonate. Next question, a patient is diagnosed with intestinal obstruction. The nurse inserts a nasogastric tube and attaches the tube to low intermittent suction. For which acid-base imbalance is he or the patient at greater risk? So the patient has come with intestinal obstruction. It is not related to the respiratory system, you understood. And the nurse has inserted a nasogastric tube. So at that time when NG tube or OG tube is inserted and low suction is done, the acid is moving out from our body. So the imbalance which happens is, so acid is moving out means alkalosis, and it is not related to the respiratory system, it is related to the metabolic system. It is metabolic alkalosis. Next, the patient's ABG results indicate worsening respiratory acidosis. Respiratory acidosis, you need to understand the partial pressure of carbon dioxide is more than 45 mm of Hg. He has a rapid, shallow breath and decreased bilateral breath sounds. Which intervention should be the nurse's first priority? So, there is some problem with the ventilation, you understood, and here more carbon dioxide is there in our body. That is what is respiratory acidosis. So more carbon dioxide, again more carbon dioxide should not be there. We should ventilate the patient. So the answer is prepare the patient for intubation and mechanical ventilation. Then only the patient will be getting enough oxygen. Let's see the other option. Administer an antibiotic for suspected pneumonia. It is not required. Administer diuretics for heart failure. It is not given in the question. Encourage the patient to breathe into a brown paper bag. This is done when the patient is having acidosis. The patient is having less partial pressure of carbon dioxide. That means the patient is having alkalosis. So when the patient is having respiratory alkalosis only, we will encourage the patient to breathe more carbon dioxide. If breathing to a paper bag and again inhaling means carbon dioxide is again taken in, then only carbon dioxide will be more. So this is done. The third option is done only when there is respiratory alkalosis. Here respiratory acidosis is there. So we need to intubate and mechanically ventilate the patient for getting more oxygen. Next is a case scenario. Mr. Peter met with a road traffic accident and has got chest trauma. In the emergency department, the vital signs are febrile, BP is 100/62 mmHg, respiratory rate is 8. ABG shows pH of 7.30, partial pressure of oxygen 80 mm of Hg, partial pressure of carbon dioxide is 65 mm of Hg, bicarbonate is 24 milliequivalent per liter, blood alcohol level is 0.24%. So here you understood the pH is less, that means acidosis, and also the PaCO2 is more, that means it is related to the respiratory acidosis. The bicarbonate has no problem. Clinical presentation: decreased level of consciousness, facial laceration, respiratory distress. Chest X-ray reveals right-sided pneumothorax. The management is with oral intubation and is on mechanical ventilator. Chest tube is inserted on the right side. Analgesics via infusion is given. Orogastric tube for gastric decompression. Let's see the first question based on the scenario, which is the acid-base balance which Mr. Peter is being treated for. Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. Already we have told the answer, it is respiratory acidosis because the pH is low and also the PaCO2 is more. Next question. Peter's treatment includes chest tube insertion for pneumothorax and artificial airway insertion for respiratory distress. The clinical team places immediate nursing orders for which of the following? OGT insertion, ECG monitoring, enema, repeated ABG, physical therapy and occupational therapy consultation. Of course, OGT should be inserted to decompress the stomach. Then ECG monitoring should be done, and of course there should be a repeated ABG analysis because the patient is on ventilator. Third question. Mr. Peter begins to regain consciousness and is extremely agitated. The clinical team wants to evaluate his neurological status before starting sedation to calm him. What nursing intervention should be used to calm the patient? Options: restrain patient's wrist. It should not be done because again the patient will be agitated. Speak calmly when patient is agitated. That can be done. Remove relators from the room. Again the patient will be nervous. Maintaining a well-lit environment. That is not related to this agitation. Fourth question. Which is the highest priority nursing diagnosis during the emergency phase of Peter's hospital course? Impaired oral mucous membrane related to abnormal breathing pattern, disturbed sleep pattern related to frequent treatments and procedures, ineffective family coping related to stress reaction, impaired gas exchange related to trauma and agitation. Here the question is asked highest priority nursing diagnosis. So that is impaired gas exchange related to trauma and agitation. The next question. Peter is shifted to ICU from the emergency where a new graduate nurse is seeing his nursing priorities. What are the top nursing priorities? Select all that apply. provide family and patient teaching, monitor vital signs, monitor ABG values, maintain orogastric secretions, maintain patient's artificial airway. The priorities are monitor vital signs, monitor ABG values, and maintain patient's artificial airway. The other two are important but not that much. Hope you understood this video. Thank you so much.